points that Jim referred to. And we didn't have a lot of community engagement. We didn't even know how to spell that. That wouldn't happen until later on when we got closer to the end of the decade, and Rosalind Carter focused us on mental health, and we did our community mental health outreach efforts, and we created board and care homes, and we discharged our veterans and those with mental and physical disabilities into the community to deinstitutionalize. And when we got into the communities, we went, holy cow, they may have a pill, but they don't have a buddy. They don't have a way to get transportation. They don't have a way to talk to somebody. They don't have peer support. We have no idea to measure what we're doing with these individuals and what constitutes success. We've come a long way, and we've come a long way because of those people in the room and your partners in the community. And I thank you. It's just such an honor to be part of this this community, this team, this tribe. I'm going to use a few notes, which I usually don't do, and I want to share with you a few minutes today what I'm honored now to be able to do at the Department of Veterans Affairs. You'll be hearing some special announcements from the Secretary tomorrow, so I don't want to steal his thunder, but what I want to give you is the tactical. You know, some of the strategic vision of why we're doing what we're doing, and then some of the tactical, very practical things we're doing. And if any of you want to have a conversation, have an idea, have a complaint, have a recommendation, a compliment, make sure you get in touch with me while I'm here. And my team from the Veteran Experience Office and colleagues from the VA, we're all here to listen. And that's what our theme is. I had an opportunity to come back into government to leave TAPS, and I did so because this was once in a lifetime. The Secretary McDonald had stood up the Veteran Experience Office, VEO, and he had taken after the Phoenix Challenge, just like we did at the Pentagon after the challenge at Walter Reed. These crises gives us an opportunity in time that we've got to seize. And so Secretary McDonald said, we need something that to infuse the Department of Veterans Affairs with the tools to do the customer service that they want to do. So he created the Veterans Experience Office, and he brought together the best practices in business and industry, and he talked to folks like our friends at USAA and friends in the healthcare industry doing things to really make sure they were serving patients well. And we had data, tools, technology. What wasn't done until more recently, when I had a chance to come in and work with our great team that has been there for a while, we didn't hardwire this capability into the fabric and the sinew of the bureaucracy. And for those of you who've worked with government or in government, you know how essential that is. You can't put something on the top and expect it to live and thrive and have its impact. So we had to do that, and we had to include another of the capabilities, the fourth one, and we really had to ensure we were getting engagement right, not only with our colleagues across the department, but also with the communities. Community veterans engagement boards and community organizations like yourselves. So that's what we've been doing the last 2 years. I'm going to just give you a little snapshot of what has happened already and some of what my vision is going forward. We are the Secretary's shared service for customer service. I report directly to the Secretary, and he has now made customer service, as you know, a highest priority for him, overarching everything that, and actually employee engagement, employee satisfaction. He understands how critically important those both are and how they have to work together. Why we do this customer service? Because we want to make sure that the services we deliver, whether they're care, benefits, or memorial service, are the best and consistent highest quality, just like we were doing 10 years ago and more, as Jim mentioned at DoD. And we're doing this not only for the veteran, Of course, the statement that Lincoln made about caring for the widows is very, very important. But we explicitly now are using the term caring for our veterans, caregivers, families, and survivors, as Jim mentioned. That is our brand now. That is what we do. And it doesn't require statutory authority from Congress to be able to make sure we are inclusive. No service member serves alone, and no veteran is able to live successfully the rest of their life alone. So we're acknowledging that now. Of the 4 areas that we are building in, the data, tools, technology, and engagement, I want to tell you a little bit about each of those very quickly. The data, we are using this incredible software tool that is artificial intelligent and enabled to give us real-time, what we call veteran signals, listening to the experience of veterans in real time. Not just an annual survey, not just a long, lengthy email survey or paper survey that you might get after you have services in the VA, but in real time, short, succinct, asking you the questions, asking you as a veteran, the questions that you have told us are most important to you. We don't need to ask about the color of the paint and whether you like it on the walls or not, if that's not important to you. We do need to ask you about scheduling, because you've told us that's important to you. So we are using our data to collect real-time feedback from veterans. We've started this with the VHA, and what that allows us to do is not only measure things like the Forrester metrics of trust, ease, effectiveness, and emotional resonance, but it allows us to drill down and look at the experience of the veterans as they use our services. So our outpatient surveys, our real-time outpatient surveys, we're able to find out immediately what the experience of that veteran was when they went into the dialysis unit at a particular VA medical center, in a particular visit, in a particular state. We can get that feedback. And why we need to have that feedback, because that enables us to know a couple of things. How that veteran fared when they went in to get their dialysis, and also how we can help the experience of all the veterans using that dialysis clinic improve over time. So we're looking at trends, and we're able to get that feedback not only at the highest level to the secretary daily and weekly, but we're also able to give it to the department director. We're able to give it to the medical director so that they can make changes. That's the whole point of customer service, to respond to the experience of the customer, in this case, our veterans, families, caregivers, and survivors. And so we're able to do that. We're rolling that out across VHA in our outpatient services, inpatient, at the national cemeteries, the VBA, and the Board of Veterans Appeals. That changes everything, because that means we can no longer say, well, we think they're doing okay, we think they like what they're doing. No, it's known, it's public, and that forces us to be accountable. That forces us to be responsive. We have an obligation already, and this gives us the tools to be able to make change. And that is exciting to me. In addition, so we have about 1 to 2 million veterans who are eligible to take these surveys each week. We have a 24% response rate out of our surveys. So we're looking at over 30,000 responses each week. And that tells us about their trust and, again, their specific experience with particular care benefits or memorial services. So we have the data, and we're able to analyze that by race, by ethnicity, by location, by age, by gender. Do you know what that means for health equity? We were analyzing this yesterday with the VA Health Equity Office, and we're going to be able to say what the experience of our Alaskan Native veterans is in real time and what's particular to them and important to them and be able to respond. Now, their clinicians should be able to do that too, but oftentimes they're not equipped and it doesn't come up to the leadership at the hospital. We'll be able to address that now. So we're also looking at our tools. And here, this enables us to execute. Once we listen, you have to do something about it. It's kind of like my see, care, do. Once you see things and it touches your heart, you have to do something about it. We're equipping ourselves to do something about it. And so we have we have a patient experience program, a benefits experience program, and an employee experience program. All of those specifically to enable our staff to do something about customer service. In patient experience, in the VA medical centers, if you've recently visited, you'll see red coats. A standard way of identifying somebody who is there to greet you, to answer your questions, to support you as you navigate through the hospital. We have green gloves programs that we've borrowed from business and industry best practices. And own the moment training, and that is how you engage with a veteran or their family caregiver and survivor, to be able to know that you are connecting with them for emotional resonance, that you're hearing what their needs are, and that you're able to respond. That own the moment, it's a train the trainer model. We've trained over 30,000 people across the VA, and that will be rolling out for the benefit side as well as the health side. It's our standard training now. We have the welcome kits that we've introduced with the transition assistance program. Boy, I'm trying to go fast because I know Jim only gave me 15 minutes up here. Sorry. Take a breath, slow down. Huh? No, I don't have a lot of time tomorrow. It's a whole other topic tomorrow. I can't wait to talk about it. Can't wait to talk about caregivers tomorrow. Something very dear to my heart. So, we have welcome kits, and they're written in English. Amazing. They don't look like the Federal Register. And now every service member, I mean, really, what's that about? How can you understand? When we all discharge, you don't even want to go to TAP, let alone you don't remember what they said. Now there's something in English with single sheets of how you access services. And in those welcome kits, we have, those are distributed not only across the VA and to the service members and veterans, but Capitol Hill has them, and they use them as their tools for doing constituent services and recovery. Go on the website, you can get those and download those. We have journey maps that we're doing using human-centered design that tell us what the experience is from accession to memorialization. Our technology is really, really amazing. And we're able to do now multi-channel listening to the voice of the veteran as we, as the Secretary says, walk the post, and we understand through multiple channels, including things like not only our crisis line and homeless line, but we have the VA hotline, the White House VA hotline. That's under my office, and we're able to take the concerns, the complaints, and the recommendations and put those through a customer service process, so we're able to get those more expeditiously addressed through VHA or VBA. Please use the hotline or recommend it to veterans who need assistance, 1-855-948-2311. We also implemented Vets 360. It means that for the first time, if you put your information in to change your address in one location, it'll be changed everywhere across the VA. Now, I found out that's not entirely true. The other day when I was at the pharmacy at DC, it's not connected to that particular pharmacy, but we're living through lived experience. We find out where the little glitches are, and we've already got that underway to fix it. But this is really huge, and over 1 million veterans have already changed their data in one place. We'll also be rolling out vets.gov. We now have, We've had some confusion of vets.gov and va.gov. You know, we've had multiple sites. Veterans told us they would like to have one, please. So we'll be doing that and rolling that out to improve the ability of our veterans to navigate on the website. I don't know about you, but it's usually the last place I go. Usually the first place I go is pick up the phone and call a friend, or I'll go to Facebook and find out what works, what doesn't work. That's where I get my kind of Angie's list on the ground. But we need multiple channels for everybody so they can go at any time, day or night, to find out what information they need. And because the hotline is live 24/7, they can also talk to a real person. So we have the data tools technology, and I'll just wrap it up by talking about the engagement that we're doing. And here's where I want to thank America's Warrior Partners and our community veteran engagement boards, especially those who've been involved in the task force. You have done a tremendous job of identifying on a voluntary, grounds-up basis how you want to organize yourselves in the community, how you want to address things like education, outreach, how you want to address your leadership in the community, and how you want to measure yourself. And because you've done that, it mirrors what we're also doing in the VA. We have a new effort going on to make sure that all of our outreach is going to be connected to measurements and metrics that are tangible, so we can see our own impact and share it with you and get yours and see what a difference we're actually making in the lives of our veterans and their families, caregivers, and survivors. We will talk tomorrow a little bit more, and I think one of the breakout sessions is on the task force. With the task force and the efforts that are going on with MVI and other organizations across the country, and AWP, we're able to make sure that as we walk the post, we're actually walking tangibly in our communities. And I thank my own community engagement group so much for what they do every day. This is not yet my last hurrah, but it's after 5 years, I want my pin, Jim, you know, please. And I feel pretty driven about this moment in time and the ability of, with the backing of the Secretary, who you'll hear tomorrow, and the urgency of addressing things like choice in the community and the Mission Act and the expansion of the caregiver stipend and other programs. It's a moment in time that we have again together. It's thankfully not connected to the tragedy that Jim referred to that day that changed all of our lives, but it is connected to the ongoing serious needs as those veterans who are engaged in that fight come home and are at home, and they need to be able to choose to live complete, whole, productive, fulfilling lives in the community, and we have to be there alongside them. And the VA has to enable you all to do what you do best, and that is to be their partners with them and their families in the community. So I look forward to our work together. I look forward to calling out when there's some opportunity that we can do. We have several really good MOUs. My colleague Deborah is here from the Strategic Partnership Office at VA. We're looking at ways we can collaborate with you. We certainly have a lot of personal relationships with people in the room, and that has enabled us to help individual veterans with service recovery. But we want to make sure we're seeing trends and we're able to do program improvement so we can really say that we are the best in customer service. Sorry, I left something out, Jim. One more minute? Okay. All right. So the most exciting thing is talking about the moment, seizing the moment. So the President's has a management agenda, and in that management agenda, one of the primary goals is customer service. And to make that a reality inside the executive branch, OMB issued a circular. It's called 811. And that circular talks about the requirements each agency now has for customer service. So HHS has theirs, Social Security, on and on and on. And they have to report to the executive branch what they're doing in customer service. Well, lo and behold, despite some of the clips you may see, the lead agency for customer service in whole of government is the VA. Why? Because Secretary McDonald identified the need early on and set up the data tools, technology, and engagement in the Veteran Experience Office. So we are the lead in the government for customer service. And we are required now, and we are working with our colleagues. So we are going to HHS and doing memorandums, and we are going to DOD, and we are getting detailees from those organizations, and we are teaching them about customer service so we can hardwire that relationship from where our veterans come to where they'll be able to go in other agencies and get the best federal service. And we'll be rolling this out over the next couple of years. It is key to making sure that whole of government is responsive to not only all citizens, but especially to our veterans, families, caregivers, and their survivors, which to me, we owe the greatest debt. And so, no wonder I don't sleep, and no wonder I think this is the best opportunity that, I may have had so far. We'll see what comes next, but I'm glad that you're on this with me, and so we're a team for customer service. That's the thing you'll hear the Secretary talk about, and I just feel very, very blessed to be on this part of the journey with you all. Thank you.
Ladies and gentlemen, it's time for the first session. Please welcome the panelists for a discussion on defining community and collective impact. This panel will be moderated by Fred Wellman. Joining Fred, Kelly Lamb, Jim Lorraine, Jim McDonough, and Carrie H. McDonough.